Nagaland witnessed a significant spike in death registrations during 2021, marking the highest numbers recorded in over a decade. This insight comes from the recently published Annual Report on Vital Statistics of India, based on the Civil Registration System, 2022, released by the Office of the Registrar General of India. While raw figures initially suggested that both 2021 and 2022 saw similar highs in registered deaths, deeper analysis paints a very different picture. In their unadjusted form, the numbers show that the state recorded 3,780 deaths in 2021 and 3,820 in 2022. However, these figures are misleading because they include delayed registrations, cases where deaths that occurred in previous years were registered much later. To get a clearer understanding, researchers adjusted the data by removing those late entries from previous years and adding in deaths that actually occurred in the target year but were only registered in the following one. After this adjustment, the numbers shifted significantly. In 2019, there were 2,252 registered deaths, which became the baseline. This increased moderately in 2020, with 2,478 deaths. Then came a dramatic jump in 2021, with adjusted figures revealing 4,443 deaths, an unprecedented surge. By 2022, the numbers had fallen back down to 2,274, returning to near pre-pandemic levels. This analysis strongly suggests that a combination of underreporting and registration delays during the COVID-19 pandemic created a backlog. As a result, many deaths that actually occurred in 2021, the peak mortality year, were only registered during 2021 and 2022. This backlog distorted the raw data and masked the true scale of the 2021 mortality spike. In essence, when you account for these delays, it becomes clear that 2021 was the year when deaths in Nagaland truly peaked, with 4,443 adjusted registrations, a number largely driven by pandemic-related disruptions in reporting. These revised figures correspond closely with Nagaland's known COVID-19 timeline. The state experienced its most severe impact from the virus during the second wave in 2021, which was far more intense than the relatively mild effect seen in 2020. By the end of 2020, Nagaland's health department had reported just 69 COVID-19 deaths from a total of 11,929 cases. This gave a case fatality rate of 0.58%, which was well below both national and global averages at the time. But things changed dramatically in 2021. By January 1st of 2022, the total number of reported COVID-19 deaths had reached 686, since only 69 were recorded the previous year. That means 617 deaths occurred in 2021 alone. However, this official COVID-19 death toll of 617 for 2021 stands in stark contrast to the adjusted civil registration system data, which reports a total of 4,443 deaths in that same year. When compared to the pre-pandemic average of roughly 2,250 deaths per year, this indicates an excess of nearly 1,965 deaths, a surge of about 79.27%. This level of excess mortality suggests that the actual number of COVID-related fatalities in Nagaland during 2021 may have been more than 3 times higher than the officially reported figure of 617. This trend of significant underreporting is not unique to Nagaland and has been observed in civil registration system data across India. Looking at the longer-term trends reveals another striking pattern. While the 2022 unadjusted death figure of 3,820 may seem high in a recent context, it is actually much lower than the numbers recorded before 2014. From 2004 to 2013, Nagaland averaged over 6,750 death registrations annually. The highest was in 2013, when the state recorded 7,056 deaths. But in 2014, the number dropped sharply to just 1,975. From that point onward, and up until the COVID-affected years of 2021 and 2022, the number of deaths reported annually remained consistently below 3,000. The reasons behind this sudden and sustained drop in death registrations after 2013 remain unclear, but the low baseline it created makes the massive surge in 2021, both in raw and adjusted terms, even more dramatic. Despite the overall rise in registrations in recent years, Nagaland still struggles with timely reporting. The state ranks among the lowest in India for deaths registered within the legally mandated 21-day period. In 2022, only 30.7% of deaths in Nagaland were registered on time, placing it second lowest in the country. Only Arunachal Pradesh had a lower percentage, at just 15.4%. The situation is even more concerning when it comes to birth registrations. Out of 80,813 births recorded in 2022, only 1,709, just 2.1%, were registered within the 21-day legal window. In fact, many birth registrations were done more than a year after the child was born. Nagaland also ranked second lowest in the country for medically certified deaths, with only 343 such certifications recorded in 2022. Bihar was the only state with a lower percentage. The national average for medically certified deaths stood at 22.3%. To understand the reasons behind these troubling patterns, such as the delay in registrations and the dramatic drop in death reports after 2013, detailed queries have been sent to the Department of Economics and Statistics, which is the agency responsible for compiling civil registration system data in Nagaland. The report will be updated once a response is received.